Welcome everyone. Monday night live Q&A with Dr. Rob. We're grateful for those that are joining us. If you're watching this recording, come join us in person, 5 p.m. Pacific time on Monday night. So join. So Dr. Rob, welcome. Lovely to
Thank
see you
you.
in your sunny yellow shirt.
Indeed.
We're going to get
Appreciate.
started. The first question, Dr. Rob, is the trade partner here. My husband is working on his disclosure for decades of acting out. He has done his document, so I gave my list of questions to him and his CSAT. We discussed a few of the questions that I wanted clarification about the situation. His dysfunctional thinking has changed the reality of those situations, and I think he truly believes his version. One of the situations, he totally changed reality. The other, he changed reality quite a bit to minimize the situation. I'm not sure if he even knows what the truth is. Will a person with this level of dysfunctional thinking be able to give a truthful disclosure?
So I'm going to go out on a limb here with this one. I think he knows exactly what happened. I think he knows exactly what the truth is. I think that's a bunch of bullshit. Excuse my language today. Tammy doesn't like it.
No,
Um,
I'm good. I'm with you. It is.
I have been doing this for 30 years, and I sometimes there is so much behavior that there are parts that I've forgotten completely. You know, when someone's doing like 15 years ago, maybe I did that, I don't remember. But if there's things on the table, I want to read the question again. Hold on one second, Tammy. Um, I don't think his dysfunctional thinking has changed the reality of situations. I think his wanting to save his butt has changed the reality of situations. And I don't think he believes his version. I think he believes that you will believe his version. And he's totally changed reality for you. And the other one has changed reality quite a bit to minimize. It's all minimizing. He doesn't have dysfunctional thinking. He knows exactly what he's doing. I Trust me, I've done this enough to know that, I think it was like this, what it really wasn't like. I'm not really sure. He knows every single thing that happened. And so I don't, if I were in a disclosure situation, this is not what I would do. I think that you are paving a road toward regret and pain. And to all of you spouses, it's one thing to hear everything. It's another thing to find more later. And I would rather that you, by the way, we have a lovely treatment center here in California. And if that's where he is and you have the resources, by all means, put him in front of me and I'll really enjoy getting more information out of him. And I mean that. I love our program and I see men come out changed for sure. One of the things I love about this work, by the way, unlike working with people long term therapy, is I see them move quickly. And when I'm working with someone, I'm just digressing here, but when I work with someone who's profoundly mentally ill or has serious personal issues, I see them an hour a week. It's not hard we get there, but it takes a long time. And one of the things I love about treatment for me is watching people move quickly. I think that's part of the reason I love this group. But I think he's a big fat liar. And unless he's now, if he has senility, or some kind of Alzheimer's, or there's something meaningful going on with him that he really doesn't remember things, I would think that'd be global. So it would occur in a number of settings. It wouldn't simply this. So I don't mean to be insulting, but I think you've been fed whatever is being fed to you in whatever way he thinks you'll believe, and you do, because you're already questioning whether it's true or not, and it isn't true. That's my two cents. All due respect.
Yes, and I'm reading, and I think I've got the correct that you gave your list of questions both to him and to his CSAT directly, not to him to give to his CSAT. Because if that didn't happen, but the other thing is, where is your professional in all of this? I think that would be really important to share that with your professional that's supporting you in this, so that you can say, "This is what I'm concerned about." Your CSAT or APSAT could or CPTT, your qualified professional could help advocate for making sure, there should be releases signed. And so if your therapist is reaching out to his therapist and going like, we're hearing minimization and we're concerned, so that would be an opportunity for his CSAT. But there's another thing about this, and I don't know if this is on track or not, but it came to mind, so I'll share. Sometimes, like this delays the process. Like, oh, now we've got this issue. And so then we're going to kick the can down the road more. And so if there's hesitancy in all this, which is completely what I'm reading anyway, well, now there's another problem. There's another wrinkle. So now we've got to work on that and we can keep procrastinating, so if you have said, and this is just a wondering, if you have said, if I learn about this, this is a deal breaker, and he knows that there's this, there could be, and you may think differently after, after all of this is done or not, but at some point, I would invite you to really talk to your qualified professional and get your professional advocating on behalf of this, because yeah, I see a hot mess coming too, and I can't tell you how often we hear about, multiple disclosures because there was, half truths and things that I didn't, I know if she finds this out, she's going to leave me, but guess what? You find out and now it's worse. And so if he's watching this, this is an invitation to knuckle down, get this stuff, you're always hanging on to this stuff and you're lying. I mean, denial is I'm lying to myself first. He would really be delusional to me. I'm with Dr. Rob. If he actually believes all that stuff to me, it's more like, yeah, I'm going to tell her this, and knows that that's not the case. So I really advocate for you. Make sure that you've got really good support in all of this, because this does feel like it's a precarious situation.
Tammy, could you say something about boundaries for her? Because I think that there might be something useful because it seems just a little about, well, if he does this and if he does that, and what does that mean? And I'm concerned a little bit about her putting so much energy on what he does and doesn't do. So do you have any quick thoughts about him? I mean, to keep
I
going.
do, and I'll throw some webinars that we've recorded about that. We have healthy boundaries work groups coming up as well. And again, I'm really hoping you'll lean into the help with your qualified professional with all of this, and because this feels very messy and chaotic over there with him. And so what do you need to do to take care of yourself? Do you have some bottom line things of like, if we don't have a disclosure and here we are, mid-August, um, so, what's the plan for this? Is it, by the end of August, or is it, by the end of September? What is the goal for that? What does this look like? And are you in therapeutic separation? Is there a plan for therapeutic separation if this is not, completed within a certain time frame? There's a whole bunch of things, and so that's why I'm asking, lean into your. But yes, having a boundary, because I was going back to with the like, well, I'll just delay and throw another wrinkle in, and then we can postpone this, and it could be even, clinically advised he's not ready yet. Well, then what does he need to do to get ready? Again, we have an expert residential treatment program that can help expedite that process, and you said decades of stuff, it's challenging if you're 30, it's way more challenging if you're older than that, because you've got more, you've got a swath of, pain that follows you. So, and this is not, every single detail, but I hear that you've got a specific list of
Right.
questions that you're looking to have answered. And so hopefully your professionals also help you, frame those, as well. But his CSAT should have that information to be able to identify what needs to be shared as well. So lots of support for you. Make sure that you're getting taken care of and you've got boundaries, and, and I don't know what your, I don't know what your, bottom line, is on all of this kind of stuff. For some, it's like, yeah, I don't, I've spent all of this time. I don't want to lose another decade, while they, and that's an exaggeration, but well, actually it isn't. Like I hear that fairly often of like, they're frittering around. We've been on this path for, 8 years, and he just, like at some point for some partners, not saying it's you, it's like, I need this insanity to stop. Now you can stay in a relationship with an addict, an active addiction. And I will tell you, when I'm reading this kind of stuff, that is not somebody who is forthcoming and working. I don't hear like a whole bunch of, I'm going to do recovery. Yeah, I'm committed to this. I'm going to show up and do my work. I hear, kind of spinning around over here. So there's some concerns from that standpoint as well. So
I just want to say one more thing. I think a date is really important.
mhm.
By this date, I don't think there's any reason, and if you want September 15th, I wouldn't make it a long time, but,
I
I
agree.
need
Yeah.
to know, I can't remember. It'll take me a few months. No, you have a right to say, and I never do more than 90 days when I was doing treatment for disclosure. I won't say what other therapists will do, but my goodness, please set a date for yourself so you're not sitting around in anxiety wondering, and let him play with it. By the way, if he says,
Yeah.
"Oh, my CSET said no or yes," or don't believe that, you actually have to. We actually lie to about what our therapist said.
But even if his CSAT says no, we can't do it, by the middle of September, like give him one more week, or say, okay, let's do it. Like at some point, if you're getting a whole bunch of pushback, that's a whole bunch of data for you. Like, I was just emailing somebody about willingness and capacity. We talk about that. There's willingness and there's capacity, and so it's important for a therapist to understand where the challenges are, because you can work with some of it and you can't work with the rest of it. But if somebody's really digging their heels in, like there's a big chunk missing that feels like there's an opportunity to do some work. But I really would hope that he goes, oh wait, I got to get the fire going and get this done. This is important. I want to have a relationship. I'm not just going to keep lollygagging. But we will. Trust me. I do this a lot. I can't tell you how many emails I hear and I go, like just it's like the stall, stall, stall. And I'm like, man, get this over with, from the standpoint of so that you can start moving forward, otherwise you're kind of, in that swampland.
Hey,
So,
Tammy,
yeah,
did you say lollygag?
I did. I
Lollygagging?
know
Okay.
I did. I thought you were going to say by jingles or by golly or something like that. So we're
I was
going back
thinking
to
like I
old
haven't heard
wording.
that in a while, but
I
anyway,
know.
go for it. I don't even know what it
Yeah,
means. Tell, I want to
there's
know
a
what it means.
lollygag. So
Okay.
yeah. Okay. Could say worse words, trust me. Okay. Do you have any advice to integrate the Madonna whore split compartmentalization? My partner thinks his spouse is for companionship while sex workers is where he directs his attention, sexual desires, and lust. How to help him integrate desire, lust, and companionship love into one person, their spouse. Oh goodness. I'm like, well, there's another. Come to a residential treatment program. That this feels, yeah, like anyway, go ahead, Dr. Rob. That's a
I actually want you to start, Tammy, because I think this is such a, I don't know. I don't even know how to, there's this way that it's being explained that I'm not sure. Well, I'll just say it. Um, this is true. This is how a sex addict lives. We put this over there and it's in a box, and we put that there and it's a box. And this is how we have to do it because if I were to hold on the love and care and emotional connection I have with you, hopefully I wouldn't be able to do this. So I have to shove you and everyone else in a box and say, that's over there. And then over here, I get into the intensity of my sexual acting out. And then when it's over, I know it's a problem. And then I go running back to my family, keep my mouth shut. So yeah, it's like, I'm trying to think of a metaphor. But I can't really think of a metaphor. But anyway, the bottom line is this is what allows addiction to continue. And by the way, when we're in treatment, what I do is I pop this bubble, and it's very, in order to maintain this, you have to have denial. So I have to be able to say, for example, oh, I really love her, but I'm just doing this, but she won't know, or because I'm not getting this from her, and part of the work is saying, you know what? You say you love and care about your family, but you're doing this. So my job in part is to break that compartmentalization. And by the way, the word integrity means doing the right thing when no one else is around. And so clearly he is not interested in doing the right thing. He's just, he is keeping the balls in the air. And that's what's really going on with that. There's some other part of that question I wanted to answer. Hold on, Tammy. Because I talk and talk and I don't actually read, and that's a problem. So how to help him integrate desire, lust, and companionship? I don't think you can. I think that's what takes, well, let me say this. I think, and Tammy's gonna talk about this. I think you can take care of yourself and do what you need for you and get your support and nurturing and love from someone who's actually available to do it, like friends and family or children. Um, there is nothing you can do. So let me give you an example from alcohol. Um, Here's the compartment. I drink and I drink, and then I lie to my family, and maybe I drink a particular alcohol that doesn't, isn't is difficult to smell, so they don't know I'm drinking, and blah blah blah. And I'm convincing myself. Well, you can complain all day. Why do you drink? It's hurting me. It's hurting the family. You're driving with the kids. You can give me every reason in the world, but I'm not going to change my behavior because you can't do that. You cannot, no one actually can change anyone else's behavior. He has to make that decision for himself. Now, consequences may happen like you're going to say, you know what, you put one or the other first. And, I want to know where you're going, when you're going. I want the safety. I want you in therapy, going to 12-step meetings. You get to say for yourself, if these things aren't going on, then I'm not sure I can stay in this relationship. Then I'm not sure whatever it is that your boundary is for you. And I can't say what that is. You'll have to say it for yourself. Maybe if you say, I'm not going to stay, he might do something, he might not. Many of the men I work with are with us because they're in absolute crisis about losing their relationship, but it can't be a threat. You can't say, if you don't this, then I'm going to do that. I mean, you can, but I think it's more important to say, look, I'm going to take care of myself. And if this is, you're dragging me through the mud and you're lying and telling you you love me and doing all of this, then, I got to do something different. By the way, for goodness sake, and I have to say this, I hope he's not sleeping in your bed. I hope that that he's, I often say, why would you sleep with someone you don't trust? I hope you're getting STD tested. And to every spouse here, oh, I never did that. It was just porn. Well, I hope so. But you don't know. You just don't know. And I know when I work with men, I do consultations. I sit with them for 2 hours. I work with couples and try to challenge. And I have a man recently who said, I never touched anyone. It would never happen. And I'm not there to challenge him while I'm having a consultation, but I just thought to myself, thou dost protest too. Can you say that for me? Thou doth.
Thou doth protest too much.
Right. And by the way, just to say it, when someone's a little bit learning about lying, when someone says never or always, that's suspect. If they say, you know what, I've thought about that many times or whatever, that's a very different story. So I encourage all of you spouses, it's embarrassing, it's humiliating, but it's your own health and your spouse is not taking care of you. You need to take care of you. Go get an STD test. You don't have to see your doctor. You can go to a clinic or whatever that is, but please don't. And we've had too many spouses show up with HPV and they have, potential cervical cancer. We are not taking care of you. That's part of the box that we can put things in. During COVID, the men would go out and do whatever they do, and then they come home. Oh, I didn't get it because I know this. I know this person really well. I had sex with, and they would never. Well, they're cheating. You're cheating. So, in any case, there is nothing that you can do, and I'm sorry for that. Hold on a second. I keep going back to these questions because I keep wanting to say more, Tammy. I'm not forgetting. Just so you know, I wanted to say more. So, what makes this happen? Treatment. That's what a good therapist is for. And that's what a 12-step program is for. And that is he has to look at himself and say, I don't want to live this way anymore. And I don't want to hurt my family anymore. And he has to make that decision. And no one else can make it for him. I know we got a lot of questions, Tammy, but is there a
Well,
lot more?
I know, but like this one made my eye twitch. I was like, "Oh, my eye is twitching," and so like I need to spend a few minutes on this. Yeah, so I'm gonna. This is the calm version. I know, because I was like, and what does companionship look like? Like, I'm sorry, I'm going to go have sex over here. And then I'm going to come home and I want you to be, I was joking about the trad wife, stuff. And I was like, I want you to be the trad wife and do all this stuff and be my companion. And you're supposed to just compartmentalize all of your feelings and knowing what he's doing and show up and just be, like, I just mind boggled about that whole aspect. So, Dr. Rob did a longer time ago a podcast with Dr. Stan Tatkin talking about, it was January 2019 on sex, love, and addiction. So in that podcast, they talked about what a healthy relationship is and isn't and why it matters. Like we are healthier, happier, like all of this good stuff happens to us individually when we put the relationship first. I did wonder, and I put two things. There's a webinar on compartmentalization. I think you'll completely see him in that. But the other thing was mother enmeshed men, because this pattern shows up in mother enmeshed men, to some degree too. Not diagnosing, don't know, but that level of, I'm going to have sex over here. It could be, a component of it too. Don't know. But I'm there. I do not know how you would, on an outpatient basis, do this. And well, you can, but I would anticipate. I talk about real recovery. And it's not just me. 2 to 5 years. This to me feels like the longer version of that, and that's if he's really willing to do the work. There's nothing you can't just go here. Let me show you this little webinar or whatever, and then you're magically going to go, oh, now I get this. This is ingrained in him. And that level of entitlement, that's what probably made my eye twitch, is that level of entitlement of, I'm going to go do all of this kind of stuff. And I still expect you to be home and be my companion, like very challenging. So I beg you, take care of you in all of this. And I'm with Dr. Rob, STD tests, get them. I can't tell you how many guys have come to treatment, you know, and their wives and partners believe that they only looked at porn. And guess what? They find out they have an STD test because we test them, and then they have to make, a very difficult call. So take care of you in all of this. Um, yeah, hopefully some of that is helpful. So yes, we have other questions. Do you have helpful tips to navigate this in between time? Betray partner here. We are working towards therapeutic formal disclosure. He is working with a CSAT, and I'm also working with a betrayed trauma therapist. This is literal hell.
Um, why don't you start that one, Tammy? I mean, I have a bunch of answers, but I think your compassion in this area would probably be helpful, and I'll follow you.
Okay. To me, you've got qualified professionals. We Tonglen for partners. The more work he is doing, and if you have a date, like I'm 100% with Dr. Rob, have a date, have it scheduled so that you can plan to. Because then it's also, I mean, if you have to do the day countdown thing of like, okay, one less day, until this. But the trick is also formal therapeutic disclosure isn't a magic fix all. It is just it's another piece of the components that are on a recovery path. So I think really doing your grounding work, I have a whole list. I typed them up so you can email tami@seekingintegrity.com if you're having intrusive thoughts and you're struggling with self-care. I was writing it out so much, I just, I saved it, but it's one of those things. The more he's doing the work and getting support, again, 12 step, our drop-in groups, our online work groups, the more support you each have to hold the space and understand that this is part of the process. This is unpleasant. You identify it as literal hell. But this is temporary. What he's done, he's already done. You can It won't get undone. You just don't know about it. So your brain is going, oh my gosh, what could it be? That's the challenge. And so going like, brain, I got this. I'm gonna like we've got a process. Journaling is one of the most useful things that partners can do. You can just do a data dump in your journal. Don't reread it. Like if you're writing questions about what you're looking for on the formal therapeutic disclosure, put it somewhere else. If this is just I'm just so distraught, get it in a journal, because then your brain goes, oh, it's saved over here. I don't have to have it ping ponging in my brain. So it is a challenge. This is temporary, and again, having a date. So there's a plan and leaning into the support. Like, when I'm subbing in on the drop-in groups with partners, um, having them share, we're having formal therapeutic disclosure next week, or we have it tomorrow. There's so much support, with people going like, we know, we're here. Here's phone numbers, so lean into the support.
I think my answer is fairly simple. Is you're going to have to distance yourself from him. It's not like you can have warm and fuzzy and we're together and we're just working toward this thing while it's in the air. And I'm not saying, that you got to throw dishes or slam doors, but there's a certain distance. I'm not going to talk about meaningful things with you. Maybe we shouldn't have meals together so much. Maybe I need to spend more time with other family members or out of town with friends. I don't want you to fake it, is what I mean. And there will be times, and this is the challenge of being a spouse, is something we call ambivalent love. Ambivalent love. So sometimes you're going to look at him, many of you do, spouse, and say, oh, remember when we did this and he looked so cute doing that. And remember, and you're going to feel warmly. And then 3 days later, you're going over here and say, I can't believe he did that. And I freaking hate him. And by the way, that is the challenge of a spouse, is really for you guys going back and forth. You're not crazy. This is part of the challenge of when you are violated by someone you also deeply care about. It isn't as simple as, okay, well, I'm just going to distance myself and I won't going to think about them anymore in a good way. You can't help it. But mainly, I think that some meaningful distance, and don't have an expectation we're going to be close. And don't set that up that we really, no romantic dinners, no weekends away. This is a time for quietness and being within yourself. And as Tammy said, you need to get the support now, but you're going to need it after. So I really hope that you're able to build up, especially with other women. And I know that partners say, oh, I don't want to be with those women. They're a bunch of losers, or look what their husbands have done, or you need those women. Or I don't want to be reminded of all this. You need your people. And these are people who have gone a little ahead of you in the game. There are people who are just entering. It's where you need to be. So I really hope that you take care of what you need to do. By the way, less focus on him because you'll be focusing more on you. And this isn't how anybody want it. This is not how you want it. And that's part of the ambivalence. Of course, you want to be closer. Many of you just want the disclosure over so you can begin to move and connect and move toward couples therapy or whatever. But while I'm waiting, I would really keep my distance and protect myself, because if it's really bad, you don't want to have opened up and said, oh my God, why did it get closer again when now it's this? Hey, Tammy, would you mind
Yeah,
explaining? Not everyone here is going to know what therapeutic disclosure is, and I know other people have mentioned it. Could you just give a little, sort of summary of what that is? Do you mind?
I would be happy to. So it's with qualified professionals. This is not a do it yourself job. So I will preface this with Dr. Rob does a peer case consultation group for qualified professionals who work within this field. Guess what the number one topic that they bring up is? It's formal therapeutic disclosure. So if the professionals are looking to get support to help you, you definitely want people who know what they're doing to do this. So it is a process. So the betraying partner creates their disclosure letter that is read, and ideally their therapist is really helping them hone that in so there aren't excuses or justifications or, I feel so bad that I did this, the stuff that would throw some emotional stuff in there. So a partner would go, oh, look, they feel bad. No, this is the data, this is not the gory details. If there are questions like, did he have, I'm using he and she, if did he have sex in our house with our friends, whatever, there would be certain details that you absolutely would want to know, about. But otherwise, it's more data pulled and how much was spent and how many hours a week on porn, what kind, all of those kind of things. So this is a process. I've heard of people doing a 12-hour, I'm not kidding, disclosure. My mind went numb. I can't even imagine if for either of you, but that's a whole different thing. So then the
Or
next
waiting a
piece of
year?
it. Oh yeah, that's horrible too. Yeah, so there, I would hope within a finite period of time, ideally, and it really does depend, because you don't want to do this again and again and again. So you do want the person that has struggled to be able to pull the information together. But if they're working the steps, they'll have timelines and things to pull it from. It's not a timeline. The next component of it, and I'm a big fan of not having it be he does his disclosure and then the partner does the impact letter. You just got more impacted. So I think having a period of time between those, but a partner writes a letter of how the behaviors have impacted, the family, the whatever, financially, whatever, all of that. And then again, another little period of time so that there's a respectful letter of restitution written to the specific things that are in the impact letter, not just well, I feel sorry, I'm going to do this. No, it's like, you identified there was financial, so I'm going to work, or I'm going to sell something, whatever, like, here's what I'm going to do. We identified this, and this is, how we impacted. John Taylor did what a really good webinar. I'm going to see if I can find that one. But he talked about a couple, and she had a thing about, he spent X amount of dollars, and she said, I want that money. Like that was bothering her in the recovery journey. And so he agreed. He said, here's how we can do it. And they did. So they were putting that money together. She used it for the family, so that they could go on vacations and stuff. So it was really meaningful, but that was a real restitution. That was a meaningful component of restitution. So that it doesn't magically fix everything, but it does set a really good foundation for being able to move forward. There's also, if something is remembered and not just I skipped it, but this is very compartmentalized. So there could be something that comes up that you go, oh, then there's an agreement on how that is handled. And there's, if it's a higher level stuff, we're calling our therapist and we're going to go through that. If it's, on a certain level, we can talk through it. But there's that ability to talk through, to take care of any cleanup of things that were omitted. Omissions by choice are not okay. Like this is one of those where, addict partners, if you're listening, put it all in there, get it all, like, don't do this again and again. Like, you build trust because they're like, oh, we did the disclosure and all this, and then they find out something that you omitted on purpose, and guess what, it doesn't even go back to where it was before. It goes down even deeper. So just do it right. Do it once. These people that I hear about that are doing, multiple disclosures over and over again. How painful for everybody. What a what a waste. You don't get to start being on a different path because you're still stuck in all of this tough stuff. So, but work with qualified professionals that can help guide you through this process. And then the real trick is, and do not be, I've heard this too many times. We already, by the time we get there, we've basically done it, or she's read it, or he left it out. That was intentional because like, there's so many manipulative things that happen, and don't, trust the process, get professionals, get the help you need so you can move forward, have the least amount of damage and trauma to you that you possibly can. Does that help?
Yeah, so I'm going to ask you one more question, and I don't mean to push you today, Tammy,
Mhm.
but there's so many people who are here and listen that don't have the resource. In fact, in general, that don't have the resources for therapy, and it's very important for me to consider. And I think about all the time that, you know, of maybe 15 or 20% of people that have the resources to go, so many people don't have insurance, they don't have the finances, they can't. You've got us, and you've got, a few other things. So, can you make some suggestions about what can they get? And I know our site is what you're going to say, but to meaningfully move their lives forward if they don't have the resources you might need for this kind of disclosure with two therapists and all that. Do you have some ideas?
I think it. I think it. It's challenging. I mean, there are some that are really high priced and all that, and I don't think you have to do that. I think if you're both really willing to do the work and you've done a lot of the prep, you can keep it down, to a reasonable thing. I know lots of addicts that can find money when it's for their acting out. I'm just, so to me, this is really important. Why would you not want to make the investment, in setting a solid foundation on which to build? So if there's it's gonna, we're gonna have to cancel a vacation. Guess what? I would vote cancel the vacation and do what you need to do if you can pull the resources together. I've heard of people who have worked with their sponsors or whatever. Sponsors are not trained to do this, so it's more challenging. Not every partner wants a disclosure. So there's that. So it isn't like you have to do this. It's if you want to do this. But if you're going to have some sort of disclosure, I still think it's really important to have support, for all of this. I think it's really important partners ask all the gory details because your brain is sitting there telling you, if you just know, you're going to be okay and you can make it safe. It never works. I think I heard one person that said they were glad. I think I did hear one person that was like, I needed all those details. Okay, but overall, they're more traumatized. There's more work, and if you don't have the financial support to get support, then how do you lean into qualified therapists to do EMDR and brain spotting and somatic, that because you've caused, the whole situation to, downward spiral? So I think you can always, do it incrementally. You can have a guideline on things. You can come on here and ask questions like, she wants to know like all the gory details, and we'll say that's not a great idea. You guys get to pick ultimately what you do anyway. Trust me. I say all kinds of things, and then I hear people like, "Oh yeah, I know we weren't supposed to do that. We did anyway." We provide research, no shame, no judgment. It's your life. We want you to have the best chance at living on a recovery path that you possibly can. So we have a zillion resources. They're all free. They're like webinars and, on YouTube, podcasts. There's all kinds of information that can be useful. There are workbooks and you can work through them. Again, that would be one way to do it. There are some of them that are posted on our website under the books thing. you know, Identify how you're going to do that. Have a discussion of what is our process. What are we willing to do on our own? When are we going to lean into support? I think you can come up with a plan. This is hard, and you heard, somebody's, dinking around with things. So at some point, getting professional help, could be really useful, even if it's like, you're just going to work on this and then go back to your support. If you can make it happen, there are good professionals that can guide you.
And therapy doesn't have to be every week. It could be
Right.
every other week. You can go and have a plan and carry that out during that time. I wanted to add a few just quick things. We
Sure.
do support sessions, and while they're not therapy, and they're certainly not, we can give direction around. Sometimes when people are reading this book, it's not as helpful, but you might try that book. Or we can't do therapy. I mean, I can and do consultations, but you can certainly reach out to Tammy, and she can help you find those things, and they're quite inexpensive. TAMI at seekingintegrity.com. I just wrote a couple other things down. A lot of therapists have interns. They have someone who is an associate and they're not quite licensed, we were just talking to someone the other day. They are getting ready to get their CSAT. There are a bunch of hours left in their licensing. So I'll tell you what, I was an intern once and I did this work, and I think I got moved forward because some people thought that I was good, and there are good interns out there. We just think we know more than we do. And also, I wrote something down. Take the courses. I don't know, did you mention that, Tammy? I'm not sure I heard that, but we do a sex addiction 101 course, a porn addiction 101 course. We do a course on empathy and compassion for addicts. These are very inexpensive. And again, I'm not trying to sell you anything. I'm trying to find ways for you to be able to support yourself if the resources aren't there. And I do think, like Tammy said, even just a little bit of direction, because you don't want, these are very serious issues, and the wrong move in the wrong direction can really cause more pain than peace. Ooh, I like that, pain and peace. So anyway, call Tammy. We'll do everything we can to find you. And the 12-step programs are all free. So whatever you can do, Tammy, reach out to Tammy. And by the way, if you're listening and you're not there with us now, all the stuff that we're talking about is on Seeking Integrity, seekingintegrity.com, and you will find your way through there. So thanks. I appreciate
So
that.
I'm going to add, because the support sessions, there's a link. I put it directly in there, and that is an option. And, I've gone through partners, I do some of them. I'm not the only person, but, I've worked with partners, and we've gone through all the lists of questions, like during a support session, and just to, get a framework. So it can help. But I will tell you, I did a support session with a couple. This was a while back, a few months ago. And he kept saying, my sponsor told me not to. My sponsor told me not to. And I'm like, I've got this partner sitting here going, I really need to know this. And I've got my sponsor telling me not to do that. And I'm like, I mean, they get to pick, but he didn't want to share. And so he was leaning into his sponsor, telling him he didn't have to share that, and I'm like, well, if it's within this framework, and she wants to know it, then it would probably be beneficial for your relationship if you do. So, but at the end of the day, you guys all get to pick. It's yours, So, okay. So, the next question, Dr. Rob. On prior sessions, I've heard Dr. Weiss say, I am broken, not bad. While I have empathy for my spouse's childhood wounds and maladaptive self-soothing by cheating, I still think my essay's line to cover up the cheating is intentional. So hard for me to think that sex addiction isn't intentional deception or a character issue.
So there's a bunch of different things, not
Yeah,
fully a question here, but I'll speak to what I said, which is
yeah.
malicious people mean to hurt you. I am going to cause you pain. That's very different than I'm afraid of telling you. I'm worried about what's going to happen. I just got to keep this secret, or I want to keep doing it and I don't want to get in trouble. Those are, and by the way, we do have character defects and we do have challenges, and we're not the nicest people when we're acting out, and we are capable of lying through our teeth. And those are all parts of being an active addict. Not so much when you're in recovery. It just takes a daily process of working on it and looking at yourself. But so is it maladaptive self-soothing? Sure. Could it be gambling or spending or drugs and alcohol? It happens to be sex in this case. But it is self-soothing. It is self-regulation from internal challenges that person can't manage. But I don't think you need to care about that. You don't need to worry about what it's called psychologically or what it means psychiatric, any of that stuff. What you need to worry about is this person going to be able to come to a place where we can join in the truth? And so I understand the idea. Is it intentional deception? Absolutely. Is it? Whoops, I went. Yes, I am lying to you, and I am lying to you. And is it a character issue? Of course, because someone who could lie so readily has emotional issues, and they are like 5-year-olds. But that's just part of being an addict, is covering up, lying, all of that stuff. I want to keep doing it and I don't want to get in trouble. So what I would say to you is, as an addict myself, I'm not a bad person, but boy, what happened to me. And if you heard the story, and I hope you don't have to, it's, my mom was homeless on the streets. I mean, it was because of mental illness. It was bad. And so I don't blame myself for having ended up here. I had a family member say to me once, you were always going to end up in this. You were never, I watched you when you were young. My uncle, he said, you never had a chance, is what he said to me. So were there going to be issues and problems related to how I grew up? Yes. Was I going to be a complete mess for a long time? Yes. I'm grateful to have found my way out of that, by the way, and be in a place where I can do more to help than I did to harm. But I don't believe it's malicious, because if I wanted to hurt you, I would. It's also passive. I'm so mad at you that I'm going to go do this over here. It's not like I'm deliberately so, and that's not necessarily conscious. So I certainly there are bad people, and there are people who use people and take advantage of them. And when you have a problem with it, they leave and go on to someone else. Um, but for the most part, oh, by the way, and those people don't usually come to treatment. The people, and I'll tell you this, we have research on this. If you
Mhm.
have profound narcissistic traits or you have those kinds of issues, unless you're in trouble, you're not going to come in. I can't think of many clients who, in all these years, who said, "Oh my gosh, I just want to be a better person." Maybe they did, but they came in because they're in a crisis and things got really bad, and they're afraid they're going to lose their spouse, they're going to lose their job, or so. I'm not going to move until something moves me, but nonetheless, that doesn't mean I can't. And I say this a lot, and I'm going to say it perhaps to the disappointment of you spouses. Me, I can lie in a heartbeat. I can cheat. I can tell you it's blue and tell you it's red without blinking an eye. I am capable of that because I've done it. And my character defects and challenges don't go away because I'm in recovery. What's different is I'm aware of them, and I work every single day. That's what recovery is about. For years and years, I work every single day to keep them at bay. But trust me, that liar, cheater is always there waiting to jump out and do his thing. So am I a bad person? No. Do I have vulnerabilities that lead me to want to run in a closet and be by myself and do whatever I want to do? Of course there are. But it's not your job, spouse, to feel sorry for me. Maybe the therapist, maybe, I don't know, but I have victimized you. And, I worry about when addicts say, "Oh, look at how hard I'm working. Look at all the things I'm doing. I'm just doing it for you." And we expect you to say, "Oh, good boy. I'm so proud of you." Not your job. Not your job to feel empathic, compassionate, to think about, "Oh my gosh, all this things happen to him. How could I really be upset?" Or my favorite is in sickness and in health. So now he's sick. So I have to, this is not that at all. Your compassion, he needs to get compassion from the people who are trying to deal with the same thing and understand how much pain he's in, but it's not your job. So I would say don't worry about where it comes from, and don't worry about what happened to him. And if he plays that card, I would just say, talk to someone else about that. Um, but is he a bad person because he does bad things? I don't believe so. I think there are people in the field who think, these people are unredeemable. I don't know about your beliefs, but I believe in redemption. I believe in healing. I believe in hope. And not everyone is able to grab onto that, but it is hanging down if someone wants to grasp that brass ring. So those are my thoughts, Tammy.
No, that is, I'm with you. There are, sociopaths and things like that, but those are very specific things. I know thousands of people who are in recovery, and man, oh man, if you looked at us when we were out, as we said, running and gunning, like it was really ugly, and but these are people that are amazing and I mean, they're caring and compassionate, and they show up, they're the ones that are throwing the lifelines out to new people, going like, look, it can be different. So, but I understand the hurt and the pain for partners, and you will never understand this because you would never do this. And I say this to all the partners. It's like, you would never consider jeopardizing your whole relationship for, something so irrelevant, and you wouldn't do it. So it's hard to comprehend. You can kind of get head knowledge. And what Dr. Eddie did, one, understanding behavior is not excusing behavior. So you can kind of get okay, in their brokenness, they did these things, but you won't ever feel and know. And that's why we need other addicts, because we get it. We get it. And that's why you need partners that can go, yes, I understand your pain. And they're just, it's a mental illness. It's on on the American Society of Addiction Medicine. Addiction is a mental health issue, so I have a mental challenge. I have a mental illness on some level. I
Well,
work
we
really
love you
hard.
for it.
I know, but I work really hard, just like Dr. Rob, to keep all of those really negative traits at bay, because they're there, like I can still have first thought, vengeful, rotten, horrible thing. And I just go, well, that's not who I really want to be today. And, I can
Mhm.
move through it, but that doesn't mean it doesn't come up. So yeah, it is work, and it is so worth it. And I always say, if I could wave a magic wand and an addict partner could see how good life could be, if we're willing to do the work, we'd all be jumping over valleys to get there, because it's really good. It's really different. It's not the intensity and all of that, but it's not the chaos and all of the pain and all of that hiding in secrets and not being, truthful and having a facade. All of that stuff we don't have to keep carrying if we're willing to do the work.
I just want to say one more thing. This is why we're not cured.
Hmm.
So I hear if there, when my husband is cured, or he says he's done, or he's done a year of meetings, and now look, he may or may not have stopped acting out, but people like us need to work on ourselves on a daily basis for the rest of our lives so that we can hang in the good part of ourselves. And as Tammy said, do I get resentful and angry, and do I want to undermine people? You bet. And I have people to talk about that with, who talk me through it, who talk me down, because I can certainly be there, but I can also be the most generous, compassionate, funny, and smart person, around. I just have to keep myself pointed in the right direction in order to really take advantage of those things. So, by the way,
Okay,
the next
next
question
question.
is directly related to this one. I just want to
Okay.
say
On
that.
prior sessions, oh wait, sorry, that was that one. My sex addict husband has been sober for a year from his porn and sex workers. He seems dedicated to his treatment group and 12-step meetings, but as of late, he's been using what he's learned in treatment and wielding it as a sword. For example, he's accused me of being addicted to work simply because I love my job. And this morning, he accused me of being avoidant when I don't do exactly what he wanted when he wanted me to. I'm a lawyer. I've never shied away from conflict. I'm definitely not avoidant. Have you seen this before? Does he know he's doing this? And how do I tell him it is inappropriate? It is inappropriate, right? I feel like I'm losing my mind in this relationship. I am going to, Debbie McCrae does the most brilliant 4-part talking boundary. So I'm going to find the webinar and share that with you. And you don't have to have a fight about it. Like, it's just like, yeah, the story I'm telling myself is you're trying to, blame me, or you're trying to label me, I mean, she's brilliant. So I'm going to find that while Dr. Rob, says more.
And the reason that I said this is like the other one is because here's someone who they may have stopped behavior. I'm not entirely sure, but then they ran into the underlying issues, which who I can be, how I can be, the things that I can do. And listen, my job when I'm in that healing place is empathy and compassion. My job is to say, my God, look what I've done to you. And I can't believe you stayed, or I don't know what you've gone through, or the attack and shoving away. Well, that sounds like an addict in active recovery. I mean, not an active recovery. So I don't want to hear about it. I want to blame you. I want to push you away. And by the way, I feel entitled to go back to my behavior. So I want you to ask your gut, and I can't answer this. I want you to trust your gut and tell me, do you think he's really stopped? Do you think he's lying to you? Because when this behavior reappears, it isn't just, and I've heard many spouses say, I don't understand. He's in recovery a year, but he's still an asshole. Okay, that may be true, but he is deliberately undermining your emotional mental health. He is blaming you and shaming you, and he's the one who victimized you. So I have to wonder why he's working so hard. And you also said, but of late. And I'm thinking, well, he doesn't just turn on a dime and decide to blame you and be angry at you and undervalue you and put the problem on you. By the way, that's a great way to act out. Well, if she wasn't more empathic and she just didn't work so hard and she wasn't so avoidant, I wouldn't go act out, but I'm entitled to do that again because I've been doing this work and look, it hasn't gotten any better with her. So uh, I, I don't believe that this is someone in recovery. In fact, I know it's not. Maybe they stopped, maybe they didn't. My guess is there's things going on you don't know about. And just because I love my group and dedicated, it doesn't mean I'm not still acting out. I might be going back every week and saying, I'm still struggling, but I love being in this group. So you don't know what's going on there. But he's using what he learned to wield it as a sword. He's already stabbed you so many times. Why in the world isn't he trying to heal your wound? So I ask you to trust your gut. As far as the immediate issue, I agree with Tammy. And by the way, I'm in a healthy relationship for a very long time. But the other morning, I got to say, and I won't say what went on, but it wasn't pretty. We started arguing, and I just said, you know what, this isn't a good time for this. Or, I said, let's put this down. And he said, okay. And we didn't talk for a while. And honest to goodness, it was like, did we argue about something this morning? But I was able to say enough. Um, there are times when I've said, you know what, I don't want to talk right now, or I feel really used or abused. I'll tell you what I do when I'm getting that, and we all get that. I just go off by myself and watch TV. I'll say, I had a little time to myself. So in other words, I withdraw myself. I'm not being avoidant. I withdraw myself when I'm not feeling safe. And I don't say, you're doing this, or how can you treat me? Because that's his problem or her problem. What I do is say, I think I'm going to go over here and do some other things. Of course, the best thing you can do is reach out to someone in recovery or get some support or your support group. But nonetheless, I withdraw myself from the situation. You don't have to sit there. This isn't true. And by the way, I'm so glad you love your work. I'm so glad you love your work. I wish everyone had that joy. And I believe I would be avoiding situations like this. I would absolutely be bringing out my avoidant card when I'm feeling devalued and dismissed. But you don't deserve this. No one deserves it, being blamed for even if you're difficult. Nobody wants someone to turn around and say, you know what, you're really, and I can't, and you do this and you do that, no less someone who's caused you so much harm. So I want to, I want to give this person a hug, Tammy. I want to say that you don't deserve this. I'm going to say that I would rather my husband or was masturbating to porn than treating me abusively. And I know that isn't something I should say, but you don't deserve this. And you know it, and you're saying it. So I would think about, number one, am I growing a support of my own? So I can, when I go in that other room and say, I'm not going to talk to you for a while, I have someone to call and say, he's at it again. And by the way, that's a really good therapist for all this kinds of stuff. But bottom line is, you don't have to sit there and take that. And certainly you don't have to begin to even buy into it. So I hear what you're saying is, well, I'm not this and I'm not that. You already know that. So a simple, you don't have to argue, you don't have to fight, a simple, when things get like this, I think I'm going to take some time for myself. What's he going to do? Blame the wall? If he follows you and I get follows him, you know what? I really need this time. I'll be back in a little while. So I just, my heart breaks, Cami, because no one deserves to be treated like this by anybody. And boy, will an addict pick at your most vulnerable part and say some part that you feel bad about, like your body. It might be, how much you work. It might be something that bothers you a little bit. I'm not saying that's you. And boy, we will needle right in there because we know that we gotcha, especially if we've been in a relationship for a long time. So lean into your support and don't take this and don't argue with him. You're wrong and you don't know this. And you just say, I'm going to take some time for myself and leave him in his own misery. And something's going on with him.
Yeah.
Late. What happened that everything changed? Just, I would trust your gut here.
Yes. And I put a whole bunch of different, like, you're sober, so why is your relationship still struggling? I'm with Dr. Rob. I'm not 100% sure that. Deconstructing gaslighting, that's another good one. Understanding behavior is not excusing behavior, reducing defensiveness. Can I ever trust again? And that includes the timeout boundary. And she is, Debbie McCray, she is really good at boundaries. So check that one out. She also did the safety with boundaries too. She's the queen of healthy boundaries. So she
Can
is
you
very
say
good
one more
at doing
time
it.
how can, because you've mentioned her so much, how can they
I
find her and
love
what
her
can they
so,
find?
but and I'm not smooth at it. I like, but I always go, it's the Diana Ross. Stop. The story I'm telling myself is that you're, you're blaming me for whatever, like in this case, for working too much, So I'm going to go over here and take care of myself, if you need to, contact your sponsor or whatever. I wondered too, like I still think I'm with Dr. Rob that he's acting out, but I also go, like he could use his words and go like, I'm lonely, I feel like you're abandoning me, or I'm feeling abandoned, not even that you're abandoning me. I'm feeling abandoned. I'm feeling lonely. That would be a better way to show up and go like, I'd like to spend more time with you. Or, there's all kinds of ways to communicate. He's only 12 months in. We talk about real recovery is 2 to 5 years. So if he thinks he's got it all together because he's got a 1 year chip, sorry, this is a journey. We've got big chips, and we still do the work. You got to do the work. It's an ongoing daily thing, because guess what, like Dr. Rob said, our addict is right here going like, you don't need to do that, your wife is just doing. No, It's everything is, if I'm triggered, guess what? It isn't about somebody else. It's about me. If it is always, it's about me, but it also is, I'm empowered because then that person did that. Well, they did that. I can't make that unhappen. What am I going to do about it? I'm going to lose my mind and go crazy, or am I going to go, I'm feeling lonely. Guess I'll go to a meeting, go talk to my sponsor, and there's a lot of unhealthy meetings too. So I love 12 step. I love 12 step. But guess what? There's a lot of, especially in the S world, there's a lot of unhealthy meetings. We did a webinar on navigating the 12 steps and look for healthy meetings, not the ones where they're all going, oh, you're doing good. Yeah, you're slipping every week. Well, it's not a slip. You're not in recovery. So, it's like, what are the ones where they're working the steps? What step is he on? How many of our work groups has he done? Like all kinds of opportunities. So, but take care of
Um,
you.
Tammy, can I pull out the
Yes,
sarcasm card? Because I'm going to, whether you say no,
please.
yes or no.
Please
And
do.
who's avoidant? And you're the one who's avoidant when he is shoving you away with his words. This is not you. That's a projection, meaning I'm saying it's you, but it's really me. He's the avoidant one. He's pushing you away with his words and his actions. So avoidant, you're trying to pull him in. You're not being avoidant. Anyway, okay, I let that one out.
I am glad you did. So the next one is my partner has been in S programs weekly since May of 2024, a CSAT since March of 2025, weekly SAA, and a sponsor since November. We've had two formal therapeutic disclosures, a 12-month out-of-house therapeutic separation, and significant progress. I moved home October of 2025 after formal therapeutic disclosure and polygraph. Since mid-May, I'm assuming this year, his recovery consistently declined, and we've been in an in home therapeutic separation since June. I've been nearly ready to end it. And when I discovered yesterday that over the past 3 months, he has 23 times reported on his weekly recovery planner sent to both therapists that he journaled on days he had not. Okay, he has said the check offs were accidental, but I have evidence that they were intentional. He also lied about non sexual behaviors in June and July. At this stage, how do I distinguish imperfect progress from lack of emotional sobriety when deception involves recovery and his treatment team? When is it recovery safety issue versus normal recovery struggles? More context. And then, yeah. In the same period since June, he was tasked with emailing his therapist daily reflections on SA meditations. Not once did he make an error in his tracker that he did it on dates that he did in his tracker. He sends in both her and her couple CSAT. I feel this is because he knew she would be able to cross check versus knowing I would never check his journal and still have not read the content. So he would be able to get away with it.
Well, I don't think this is a very difficult one, Tammy, but I'm going to ask you, can you speak to the last paragraph? Because I think that's really the bottom line about what you're saying.
He's lying. Like, and I hear you're, and no, I like he's lying. He, you said he's digressed. Like but he got you back in the house, and then guess what?
Right.
And that so he slapped off, and he's there's a difference between imperfect progress would be I lied to you. I know I said that, but he doubled down and said, "Oh, it was an accident." No, it wasn't. So this is like the story I'm telling myself is that you are lying about your recovery. What is your bottom line on all of this? I mean, you've gone through out of home separations, you've got in home separations. What do you need to take care of you? He's not doing the work. We have a residential treatment program for guys like him. Like honestly, like
Get him over to me.
yeah, yeah, seeking integrity. 14, 21, 28 days. He wouldn't be a 14-day kind of guy. I'm telling you. He'd be looking at 21 at least. So,
So, Tammy, I want to say one thing before we leave.
mhm.
Lollygag
Yeah, don't love it.
originated, it
Oh,
originated, you'll love this, originated as American slang in the 1800s. That means the 17 somethings. Originally meaning to fool around, flirt, or engage in amorous behavior. By the late 1880s, involved to mean dawdling or wasting time. So it had to do with lollygagging, had to do with flirting and seducing. You got to love that. Because our addicts do a lot of lollygag that.
they do. Yes. And so someone asked, why porn? I want you to say one more minute. Why porn? Why watching porn for men is viewed like some normal thing in some societies? And And even in the US, it could be, but here's the deal. Drinking, let's take it out of porn. Drinking is one of those things where you go, well, lots of people can drink, and there's age limits on it and all that kind of stuff, but for some of us, it doesn't work. It causes us lots of problems. So normalize cannabis is another thing, like it was like, oh, it's just, and for some people, okay. But so taking all of that other stuff out of it, but for some people, if it's causing problems in relationships, if there's secret lives, if there's lying, if a couple agrees that watching porn is okay, like rock on, like it's all fine. But when there's stuff that is happening where there's secrets and lies and there isn't transparency, then it's then to normalize it and go, well, everybody does it. Unfortunately, some partners have been told that by even therapists that go, well, all guys do that. Some women there, we have female porn addicts that are in
I ran a
our
treatment program and created one for women who have these
yeah,
issues. So
but we have a drop-in group specifically for women. So this is not just a male thing or so anyway, thoughts on that one?
yeah, I want to say more thing, which is you were talking about alcohol. There are cultures where you're not allowed to drink. There are religions where you're not allowed to drink. So it's really, look at porn in some places. Look, I will say this to you just as a therapist. When folks I'm working is starting to get into talking about the culture or what's right and wrong, or in my experience, they're kind of getting away from the issue that's right in front of them. Because whatever happens in the culture, you don't have any control of. And what you think is right or wrong, pray about it, talk to friends about it, write about it, politic about it. But what's going on in your relationship is really what matters. And, you're not gonna be able to do a whole lot about what's going on out there, but you could sure really focus on what's going on in here. I'm done, Tammy. I got to walk the dog,
Yeah,
as you
me
know.
too. I got it. Yeah. Thank you. Thanks,
All right.
everybody.
Bye, guys.
Come
We'll be
back.
back.